How to effectively get rid of melasma. So first up, I'll say actually for most people, you can't get rid of melasma. It's something we can treat and we can improve the appearance of, but you will be managing for the rest of your life. Let's start with explaining why. So melasma is a skin condition that results in hyperpigmentation. Very typically, it has this kind of butterfly wing appearance across the cheeks, often symmetrically also in patches on the forehead, and sometimes also across the upper lip, and it can give a kind of moustache-like appearance. It's caused by a combination of UV exposure and hormones, so it's much more common in women and often related to pregnancy, the oral contraceptive pill, or potentially also HRT. And when it starts, it can be very stubborn to treat. It's very, very difficult. You might add things that you would think to your skincare routine, like a vitamin C, and see very few benefits. What's also important is to realize that melasma isn't just sun triggered, it's heat triggered. So this is relevant when we think about treatments we might perform, and it's also relevant when you think about the lifestyle adaptations you might need to make, because actually you could go on a hot holiday, you could wear a hat, have a sunscreen with an SPF 50 in, sit in the shade, and still get worsening of your melasma. So that's important to understand. It's something to manage rather than just to click your fingers and be rid of. When it comes to treatment, our mainstay of treatment is going to be anti-pigmentation ingredients, and these could be prescription like hydroquinone or non-prescription like cysteamine. I'm increasingly steering people towards cysteamine because the results on clinical trials are extremely effective and showing equivalence with hydroquinone, but you can be on it long term, whereas with hydroquinone you have to take breaks. Also, we don't see the rebound pigmentation that we do when people stop hydroquinone. So for me, as a long-term solution, I think cysteamine is excellent. And potentially this can be combined also cyclically with things like retinoids. There's a brilliant non-prescription skincare product called C+ Correcting Complex by Revision, or the Aluminate serum by Elastic. Both of these are amazing non-prescription pigmentation treatments, and we can combine those into a skincare protocol to try and help you manage your skin, alongside also potentially retinoids. It's about a good and consistent skincare routine, and it goes without saying that sun protection with an SPF of at least 50 every single day is crucial if you want to manage your melasma. What else could we throw into the mix? Well, we often find that combining with an oral medication called tranexamic acid taken as a tablet increases the effectiveness of topical treatments and devices. So that's something I'm a big fan of doing in people who need it and whose melasma is particularly stubborn. And this is generally a very well tolerated medication. There are many women who take it for problem periods or gynecological issues, for example. Then it comes to in-clinic treatments, and here we can use chemical peels, we can use lasers, and these can have some really good effects. But remember what I said, melasma can be heat triggered. So if you're going to have a treatment that involves delivering heat into the skin and you suffer from melasma, I will always make sure that you have pigment suppression beforehand. So in the form of a non-prescription product, we can make sure your skin won't react and that the problem doesn't become worse rather than improving. We have lots of choices and lots of options, but it's important to recognize that this is about managing a condition and that your lifestyle will play a big part in that. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.